To hear the full episode, become a patron at patreon.com/deathpanelpod.
Welcome to the Death Panel. Patrons, thank you so much for supporting the show. None of the work that we do would be possible without you. To become a supporter of the show and get access to the second weekly bonus episode, as well as the entire back catalog of bonus episodes, become a patron at patreon.com/deathpanelpod. And to help us out some more, share the show with your friends, hold listening or discussion groups, post about your favorite episodes, pick up copies of Health Communism and A Short History of Trans Misogyny at your local bookstore, or request them at your local library, and follow us at deathpanel_. I'm Beatrice Adler-Bolton, and I'm here today with my co-host, Artie Vierkant.
Hello.
Now, last week, Robert F. Kennedy Jr. was nominated to head HHS, the Department of Health and Human Services, under Trump. This move potentially places one of the most prominent anti-vaxxers in the U.S. as the head of the agency that oversees and regulates healthcare, agriculture, and more, as HHS is the administrative umbrella overseeing the CDC, or Centers for Disease Control, the NIH, or National Institutes of Health, CMS, Centers for Medicare and Medicaid Services, and the FDA, the Food and Drug Administration, alongside other less well-known agencies like ASPR, or the Administration for Strategic Preparedness and Response, which is the agency charged with preventing, preparing for, and responding to public health emergencies and disasters. Kennedy will still have to be confirmed by the Senate before he can officially become the head of HHS, but with the next Senate under Republican control, HHS Secretary RFK Jr. certainly looks like a real possibility at this point. But with all of that said, even without confirmation, we're already seeing the effects of Kennedy's nomination. For example, over the weekend, the Washington Post reported that Trump's top pick to run the NIH, emerging from a list of names compiled by Kennedy, is none other than Jay Bhattacharya, who longtime Death Panel listeners will recognize as one of the original authors of the Great Barrington Declaration. So even if Kennedy is not confirmed, the Senate could still confirm people like Bhattacharya and others that share their politics, meaning that Kennedy's nomination, whether he ultimately gets the job or not, is still likely to have enormous consequences. So with all of that in mind, today we're going to take a close look at RFK Jr., who he is, what the response to his nomination has been so far, and how his nomination doesn't come out of nowhere, but instead follows decades of struggles over the political economy of health that have laid the groundwork for a figure like him to come into power.
Yeah, and before we get too far into it, I think it's important to just foreground us with who RFK is and some of his greatest hits, as it were, as a longtime crank. Because something that you see happening a lot in media reports lately is you get these very bizarre, flattened descriptions of Kennedy's agenda that could make it sound almost to be a good thing, or like he's some sort of class warrior or something. So here's Politico, for example, quote, Kennedy has proposed tighter regulation of the pesticides farmers use to juice their yields, a re-examination of vaccine safety data, a ban on highly processed foods in schools, and a remaking of the agencies making the rules around health and food, unquote. And it's not until halfway through the article that they refer to him as an anti-vaccine activist, quote unquote. Or the New York Times, for example, who referred to Kennedy as, quote, a vaccine skeptic who has unorthodox views about medicine.
That's a stretch.
Yeah, it's an understatement. Quote, Mr. Kennedy, who has railed against the revolving door between industry and government, vowed on social media to, quote, free the agencies from the smothering cloud of corporate capture so they can pursue their mission to make Americans once again the healthiest people on earth, unquote. And there are other examples, longtime Death Panel villains Emily Oster in the New York Times and Lena Wen in the Washington Post both wrote pieces last week saying of RFK's ideas like removing regulations around raw milk and removing fluoride from tap water were not that bad, actually, which I think points us to something we're going to have to address today and in the coming months probably, which is the increasing propensity not only for liberals to embrace Trump policies, but also the detrimental effect that decades of liberals embracing woo-woo shit is going to have on public health and regulatory agencies going forward. But again, before we dive too deep, here are some of the greatest hits from recent memory, sort of a roundup of some of his beliefs. So,
bracing myself.
Kennedy, of course, the top line is he is a longtime proponent of the also long debunked vaccines cause autism conspiracy theory, a conspiracy theory which of course also rests on the idea that autism is bad. Just to say, I feel like no one throws that part in ever. And despite the fact that he's often asserted that he is not anti-vax, he also has claimed that, quote, there is no vaccine that is safe and effective, unquote. He runs, or is at least instrumental in, the organization called Children's Health Defense, or he was instrumental in it until he stepped aside to run his presidential campaign, his third-party campaign. Children's Health Defense is one of the biggest anti-vax groups in the country, which also promotes a number of other conspiracy theories. Just browsing Children's Health Defense newsfeed, for example, which they call The Defender. It's full of headlines like... It's full of headlines like DNA contamination in vaccines. What is it and why does it matter? Naomi Wolf discusses chilling revelations from Pfizer documents. Small stones of truth and scientific analysis can slay the COVID establishment Goliath. And of course, they famously also just put out a new documentary, which is to say a piece of fear-mongering propaganda, called Vaxxed 3, Authorized to Kill.
Yeah, I mean, these people are well known for spreading like absolutely ridiculous lies about autism and the quality of life that, you know, children with autism can expect. It's like their entire platform relies on dehumanizing people with autism as a way of discrediting vaccines. It's sickening.
Yeah, exactly. In 2015, RFK compared vaccination in general to the Holocaust, saying, quote, they get the shot, that night they have a fever of 103, they go to sleep, and 3 months later their brain is gone. This is a Holocaust, what this is doing to our country.
I'm sorry for laughing. It's just like so many people don't understand how the immune system works. It's actually wild.
Yeah, when you get a fever from a vaccine, it's usually a sign just that your immune system is doing stuff
right,
and
that's
activated.
How you know the vaccine is working.
Right. He later apologized for that. I didn't read the apology, so I don't know. I don't know what part he apologized for. He has blamed school shootings, as well as a number of other things, on the rise of antidepressants, saying, he said this multiple times, but in one such instance, in a Twitter Spaces conversation with Elon Musk earlier this year, he said, quote, prior to the introduction of Prozac, we had almost none of these events in our country, referring to school shootings and mass shootings in general, I think. In his 2021 book, The Real Anthony Fauci, Kennedy goes off in an extended section saying that he doesn't think that HIV causes AIDS. He also told New York Magazine in 2023, quote, there are much better candidates than HIV for what causes AIDS.
Did he elaborate?
He has in other cases. Obviously, he talked about it at length in his sort of questioning, just asking questions in his 2021 book. But one of his go-tos that has been reported on a lot recently is quotes such as this, which is, quote, 100% of the people who died at the first 1,000 who had AIDS were people who were addicted to poppers.
What?
So
oh my God.
As other people have pointed out, he kind of builds on other long established kind of AIDS conspiracy theories that AIDS was caused by drug use, essentially. So, yet an additional layer of stigmatizing people. He has also, again, blamed antidepressants for the existence of trans kids.
Oh, boy.
Saying, quote, the capacity for these chemicals that we are just raining down on our children right now to induce these very profound sexual changes in them is something we need to be thinking about as a society, unquote. This isn't just a one-off either. He's referred to puberty blockers as castration drugs. He also said in a 2022 episode of his podcast, reportedly, quote, I just want to pursue one question on these, the other endocrine disruptors, because our children now, we're seeing these impacts that people suspect are very different than in ages past about sexual identification among children and sexual confusion, gender confusion, unquote, which, I bring this in part because obviously this is a very bad, dangerous belief for someone like the head of HHS to hold, but also because this rests on the thing that has been quite extensively laundered through outlets like the New York Times, such as that trans kids are new and they haven't existed throughout past periods in history, which, you know, we've talked a lot about on the show before. Further down the rabbit hole, there's also 5G stuff. So Kennedy has said, quote, they're putting in 5G to harvest our data and control our behavior, digital currency that will allow them to punish us from a distance and cut off our food supply, unquote.
This shouldn't be like a laughing matter, but, you know, it's funny to put this in the context of what was the exact framing the New York Times used, that he's, you know, got these views that are
unorthodox.
Unorthodox.
Unorthodox views of the medical establishment or something like that.
Unorthodox views, right? Like, not people saying like, well, maybe we should discuss, I don't know, the way that drug advertisements are working, or we're, you know, testing things this way or that way. It's like, no, he's talking about 5G controlling access to the food supply.
Yeah. It's funny because in that statement that I just read, until you get to the second part about the digital currency and the food supply, it's like, it sounds like he's levying a very real critique about behavior tracking and stuff like that.
Yeah, or like ads.
Yeah, you know, the stuff that we know does happen, of course, as part of what's been called either platform capitalism or surveillance capitalism, just maybe articulating it like a boomer or something. But then it just goes on
right.
and gets a little different. Anyway.
Like, I'm sure the New York Times characterizes people who are supporters of Medicare for All as having unorthodox views about the medical establishment.
Well, I mean, that's kind of the thing, though. I feel like saying unorthodox views is what they will give to right-wingers or people who are kind of like off on some woo-woo conspiracy tangent or something. Whereas, I mean, frankly, people who are for Medicare for All or defunding or abolishing the police are more often, I think, portrayed in almost more explicitly negative terms. Not only as sort of unrealistic or quote unquote unorthodox, but as people with dangerous views who are going to, for instance, cost Democrats elections like the 2024 election. In any case, of course, we could not forget his claims that made a lot of headlines over the course of the 2024 election before he dropped out from his third-party bid, where he said at a fundraising dinner, I think it was, quote, COVID-19, there is an argument that it is ethnically targeted. COVID-19 attacks certain races disproportionately. It is targeted to attack Caucasians and Black people. The people who are most immune are Ashkenazi Jews and Chinese.
What? I'm sorry.
You didn't hear about this?
No, I missed this one. I mean, I've been partially tuning some of the RFK discourse out because he's just such a classic wellness grifter. You know, you take a kernel of truth, like disproportionate deaths to COVID based on, you know, exposure that has to do with like very complicated overlapping intersecting factors of political economy and the response to COVID and systemic racism, racial capitalism, etc., and dress it up in magical realism until it's ridiculous like this. I mean, this is exactly like saying, like, you know, you can cure your neurological autoimmune disease with yoga. Yeah,
but in this case, it's COVID was not only technologically engineered by humans in some way, but also was a tool of race war, I guess, is the idea here. He pushed that further, saying, quote, we do know that the Chinese are spending hundreds of millions of dollars developing ethnic bioweapons, and we are developing ethnic bioweapons. They are collecting Russian DNA. They're collecting Chinese DNA so we can target people by race, unquote. And it's very funny if you watch the video of this happening, there's a guy like right to his left, and you can just see like him becoming increasingly uncomfortable as this goes on. Obviously, again, this is like no laughing matter, but it is interesting, I think, to see. I mean, I think in 2016, a lot of people obviously have talked about how there was a very different kind of transition environment in 2016 with regards to that Trump campaign. But I do think it is interesting that we have, compared to last time where it seemed like they were sort of scraping the bottom of the barrel with whoever they could sort of find, it really does feel like they're assembling this like wacky races cabinet this time, where you do have, I mean, I think to your point about like, oh, you tuned out RFK in the way that you have kind of been tuning him out as a wellness grifter for a very long time.
Yeah, for self-protective, psychological reasons.
Right. It's like long ago, part of the reason that he was a much more marginal figure before was that I think long ago he was, it was very clear what he was on about and easy to just kind of dismiss him. And there was a lot more, I think, public ostracism of views like those that he holds. And I think that, as we'll talk about probably in a little bit here, there's been a lot of movement, specifically in the last 4 or 5 years, but also in a longer time period, where I think we've seen a lot of this stuff just become way more acceptable, or again, presented as simply an unorthodox view or something like that, and not something that's just like, absolutely unthinkable.
I mean, for the first term, Trump had Tom Price until he got involved in that private jet scandal and resigned. And he was someone who was a Tea Party Republican, but a congressional representative, and firmly did not believe that vaccines cause autism, but was a guy who was out here to repeal and replace the ACA, right? He was one of those, like, I'm going to come and get the Affordable Care Act kind of guys. And his views on healthcare kind of started and stopped there. So you can really see kind of how far we've gone since that first round of people where, they were scraping the bottom of the barrel, but the agenda was also completely different than the agenda that is underlying the picks that are being made right now.
Yeah. So continuing on with we're almost done with kind of the greatest hits here. This next one obviously doesn't have as much to do with his views so much as just it's something that I feel like should be mentioned. There's, of course, like the brainworm thing. This is something that's, I think, gone around a lot, so I'm not going to take great pains to explain it. But essentially, there's a story that came out over the course of the 2024 campaign where he essentially said that a doctor found a dead brainworm in his brain that had eaten part of his brain, which I guess we only found out about because of, what was it, like divorce proceedings?
Divorce proceedings, where he was saying that, his income had been permanently impacted by the brainworm, meaning that he couldn't pay spousal support. So it was part of this kind of, divorce disclosure that the brainworm came up.
I think there is something kind of more interesting, though, about that fact that we found out about this because he was trying to sort of evade alimony, because the way that he was trying to argue his way out of it was by feigning a lack of capacity. You know what I mean? Which, in any case, brings us to kind of the final character trait of the situation, which, again, not a specific belief of Kennedy's, but something that I think does give a lot of context for who he is, and also potentially for why the brainworm thing is totally believable and potentially where it came from, which is that it also came out in the course of the 2024 campaign that he has had a lifelong propensity to pick up roadkill and potentially eat it.
That could be where the brainworm came from.
That's what it was. Yeah, exactly. There was the big thing that has, become the butt of a lot of jokes, like the bear in Central Park, which he did say of it, quote, "I was going to put the meat in my refrigerator," unquote. But there's also, I don't know, I saw this story and I couldn't help but bring it into the context of the show. There's also a story from 2012 that Kennedy's daughter Kik tells, which comes from this 2012 profile of Kik in Town and Country magazine. They write, quote, "Kik Kennedy's taste for the extreme was fed by her dad, RFK, her dad's eccentric environmentalism. Exhibit A, when she was 6, word got out that a dead whale had washed up on Squaw Island in Hyannisport. Robert Kennedy Jr., who likes to study animal skulls and skeletons, ran down to the beach with a chainsaw, cut off the whale's head, and then bungee corded it to the roof of the family minivan for a 5-hour haul back to Mount Kisco, New York. Quote, "Every time we accelerated on the highway, whale juice would pour into the windows of the car, and it was the rankest thing on the planet," Kik recalls. "We all had plastic bags over our heads with mouth holes cut out, and people on the highway were giving us the finger. But that was just normal day-to-day stuff for us."
To hear the full episode, Become a patron at patreon.com/deathpanelpod. You'll get access to this and the rest of our catalog of patron-only episodes, and be the first to get a new patron episode every Monday when it drops. With love, the Death Panel.